Hi everyone, this is Crystal Cargis here with you today, and we're excited that you joined us for our Google Hangout. And we are joined by our special guest, Jessica Setnick. And Jessica is a registered dietitian and also the senior fellow at Remuda Ranch. And we're so glad that you could join us. Thanks for being here, Jessica.
It's my pleasure.
So you have done such incredible work in the field of eating disorders. You've done so many different trainings. You have your eating disorder boot camp for dietitians and professionals. Can you maybe tell us a little bit about what you do, kind of what brought you to this point and where you are now?
Sure. So what I do now is I work with Remuda Ranch. My title is Senior Fellow, and that's a title that belongs to each of the Meadows facilities. Each one has one or more senior fellows, and we're advisors to our facility and also representatives in the community of our facility. And so I spend 1 week a month at Remuda working on staff trainings and leading groups and getting immersed in the program. And then the other weeks I spend working from home here in Dallas, either working on projects or going out to conferences around the country and speaking about eating disorders, always representing Remuda. So it's really a perfect fit for my skills. What I did before is I had, well, I'll just go back in time and tell you that I started out getting a bachelor's degree in anthropology because human behavior and why humans make the choices that we make really fascinated me. But at some point I took a nutrition class as an elective and sort of channeled that interest in human behavior into human eating behavior. And at that time, really, even though we know that the psychology of eating is important in every area of nutrition, at that time, really eating disorders was the only area where it was recognized at all. So I went on to get a master's degree in exercise and sports nutrition. And during that time, fell in love with the idea of helping people with the decisions that they make about food and changing and making more appropriate decisions about food. So that's how I found eating disorders as a specialty area within nutrition and dietetics. And then my first job out of school was at Children's Medical Center of Dallas. They had just decided to start an eating disorders program. It was one clinic, a couple of hours a week. And at that time when I started, it was just beginning to grow. And now, you know, by the time I left 2 years later, had grown into a huge program with day treatment, inpatient, partial hospitalization, a feeding disorders program, a huge IOP. And at some point I left there to go into private practice. And so I had a private practice here in the Dallas area for 13 years. And then during that time, I gave a lot of presentations. I started eating disorders boot camp because people would ask me for advice about helping individuals with eating disorders. And I realized that none of us had been educated in school. We all needed more guidance. And so eating disorders boot camp was a good way to share what I had learned from experience with others around the country. So I did eating disorders boot camp about 40 times, and then other conferences and people would ask me to speak at different locations. So I was doing a lot of speaking, and I decided to close my private practice to focus on speaking exclusively. And so that's what I do now. I really think it's so important that we not just educate eating disorder specialists, but also those primary care practitioners who, you know, really have a golden opportunity to help people at the beginning of an eating disorder, but oftentimes aren't aware of what questions they could ask or what they could be doing to help people. So I feel really lucky to have the position I have and be able to hopefully make a real difference.
Absolutely. And I have actually had the opportunity to listen to one of your boot camps, and it was just so informative. And I just appreciate that you are out there, you know, like you said, getting the word out and helping so many people really understand a subject that is often not understood. And there's so many stigmas and myths about eating disorders. So you're like the voice of truth in the eating disorders.
Well, thanks. I feel like that's a little bit too much. I'm not ready to sort of wear that crown because there's so much we don't know about eating disorders. And so a lot of the misunderstandings, you know, we don't have an answer to clear them up. We can only say we have to try our best. And so I feel like that's one of the messages. I feel like a lot of people feel that they cannot ask the questions or do an assessment for an eating disorder because they're scared. They don't know what they'll do if they get an answer that sounds like someone's doing something unhealthy with their eating. And so part of my mission is to help people understand that compassion is a big key in a field where we don't have a medicine that can cure everything or a treatment that can cure everything related to an eating disorder. Sometimes the best thing we have to offer is the ability to say, I don't have all the answers, but I will look into it, or I'll consult with a colleague and let me get back to you because I do want to be able to help you.
Sure, absolutely. And that's actually kind of going into our topic for today is the subject of anorexia. And I think it's a disease that is not fully understood. And, there's been so much research and a lot of better understanding about the disease. But what is some of the identifying criteria for anorexia?
Okay, so really the main criteria for anorexia is not eating enough to sustain life. So I sort of veer away from any kind of official diagnostic criteria because in the past we've missed a lot of individuals using standardized criteria, and each person's experience of anorexia might be a little bit different. So what you typically think of as the standard criteria for anorexia is weight related. And now in DSM-5, it's actually BMI related. I feel like both of those give you an inaccurate picture of what anorexia is, because to catch anorexia in its early stages might be before anyone has, for an individual has experienced a dramatic weight change. It might be before that person's weight has changed at all. And so it's really inadequate eating because of anxiety or fear about gaining weight or being fat or becoming fat. That is the hallmark criteria of anorexia, regardless of what weight that person currently is.
And what would you say, like you kind of mentioned that, some of the primary practitioners who interact with people on a daily basis may not know or be aware of some of these symptoms. So what do you think might present like in a doctor's office?
Sure. So as a pediatric dietitian, we're always trained in something that I think is so important, and I wish everyone really focused in on this, that children are never supposed to lose weight. Children may get chunkier at different stages in their growth and development, but then they grow taller, and so they sort of slenderize. Children are not actually supposed to go down in weight. They're always supposed to gain, then grow, gain, then grow. And kids have different patterns. Some kids get taller and really underweight, or look skinny, I should say, and then they gain and they fill out, and other kids gain a little pooch first, and then that's because they're about to have a growth spurt. And so instead of trying to sort of conform kids to any other kids, especially because all of our growth charts are based on certain races, and we have lots of kids out there who have heritage from more than one race, and growth charts don't really represent them. We should really be looking at a child's individual growth. And so if a child is following his or her own growth curve, that's one thing. But if a child is actually losing weight, that's always a concern. No matter what weight that child started at, losing weight in a child is always a reason to look further and find out what's going on. And I wish that all doctors that work with kids were better able to identify it, not necessarily as a problem, but as something that needs to be looked into. And actually the American Academy of Pediatrics has done a nice job trying to educate pediatricians that weight loss in a child is a big concern. And in addition, talking to overweight kids about their weight can be a trigger for an eating disorder, especially coming from an authority figure like a doctor, because overweight kids are the most at risk of developing eating disorders. And so I feel good that that organization is trying to emphasize that. I think it's information that's slow to trickle down. But to me, that would be the number one thing that you would see is any kind of weight loss in a child. Also, any change in eating behavior. But that's not something that a doctor who sees a child once a year is going to be able to observe. So as far as what you would see in a doctor's office, there would be any kind of abnormal vital signs. Bradycardia is a low heart rate. Unfortunately, we have situations where doctors feel that a low heart rate, or have said to patients that it's due to being a good athlete. And there's a limit to how low your heart rate should go, even if you're a good athlete. Low blood glucose would be a sign. But again, these are signs that something has already been going on for quite a long time. So the only way for a doctor to really see something like an eating disorder or anorexia that in its early stages is to really ask more questions about a child's eating and ask a parent about any changes in the child's eating behavior. And unfortunately, I don't think there's a lot of that going around.
Sure. Well, what about for family members or loved ones? Because I think, you know, they're kind of on the front lines, like they're seeing those day-to-day changes with eating. So what would be some of the identifying symptoms that family members might be able to pick up on?
That you're right, that's going to be a better option to try to identify things sooner, and definitely a change in behavior. So if a child, let's say, has never really been much of a snacker, fine. But if a child or a teen or even an adult has always snacked throughout the day and then suddenly stops snacking. So it's not the fact that they do or don't eat snacks, it's the change in behavior that's significant.
Right.
Someone who is isolating and doesn't want to come to family meals or doesn't want to do social things that involve meals, avoiding business dinners, avoiding any kind of fun social event at school that involves food, those kind of things would be really important signs of potential anorexia. I mean, they could be signs of other things too, like depression or anxiety, but those are the keys to me that families can look for, is some kind of change in behavior. Also things like getting up a lot in the middle of the night, that can be related to not getting enough to eat, and criticizing what other people are eating, cooking or baking for others, but not eating the food themselves. Those are all possible signs that something is amiss, and it could be anorexia.
Sure, that definitely makes sense. Thank you for explaining that. And what would be the best way for approaching someone who you're concerned about? I mean, you've listed off some really good identifying symptoms, and it can be such a sensitive subject and really touchy to approach someone who you're concerned about. So what are some suggestions that you might have for approaching someone?
Well, I think it doesn't have to be as touchy as we make it. I mean, if you had a friend that you thought had a drinking problem, you might feel that it's touchy, but you might address it anyway. And with eating, for some reason, we think, well, that's none of my business, or I shouldn't say anything. But really, it's appropriate just to express your concerns. I've had concerns about a family member before. I will not lie and tell you it was a comfortable situation at all. I just felt like it had to be done. And so what I said is, you know, can we talk about this? I have some concerns. And it turned out that I had totally misunderstood the situation, and that was fine. I was open to that possibility. But I think that's what we have to remember. And I would encourage anyone who's worried about a family member or friend to just take that person aside. You know, interventions are sort of a last resort. No one likes to know that everyone's been talking about them behind their back. So I would recommend avoiding saying things like, we've all been thinking you have a problem, or something like that. But saying something more like, here's what I've noticed. I've noticed that we never go out to dinner anymore. You never want to go. Or I've noticed that when we go to the store to go shopping or go to the mall, that you never want to try anything on. And so I'm just wondering what's changed. Just open the conversation. Even if the person doesn't really talk about it in the moment, they may be able to come back to you later and say, you know, you caught me off guard and I didn't want to talk about it, but I know that you care. And so I wanted to come back around and talk with you about it again. If not, you can always bring it up again. But the key that you want to remember in bringing it up is not that you need someone to sort of admit that they have a problem or something like that. What you want to do is you want that person to get some professional help. So if by chance they say, I thank you for being such a good friend, you know, I'm already aware of it and I'm already getting help, that would be great. If not, you could always say, you know, I'm not sure what to do. I'm just glad that we're able to talk about this, and let me do some research and I'll find out who's a good professional in our area, and I'll go with you to talk to that person if you want. And so really kind of taking the lead sometimes, because it's such a scary step for someone in getting help, but knowing that you're there with them, maybe not that different from if someone got, you know, maybe some bad news from the doctor and you were just going to go sit in the doctor's office waiting room and wait for them. You don't even have to go in with them unless they want you to, but really just to be there for support, because however awkward you felt about bringing it up to your friend, I'm pretty sure that person feels 10 times more awkward trying to talk about their eating with a doctor. So being there for them and saying, you know, this is sort of a touchy subject, but you're important enough to me that I want to get over my awkwardness and I want to try to help. To me, that's the best thing you can do as a family or friend. And if the person doesn't want help, I would suggest that you still do some research, find out who is the best professional or one of the professionals in town that, you know, is available, and go in and see that person yourself and say, I have a family member with this problem, or I have a friend with this problem, and I'm not sure how to proceed. And I was hoping that I could get some information from you on what treatment entails, and that I could go back to this person and say, I went ahead and met with this doctor. I didn't, you know, divulge your name or any personal information. I just said I have a friend or family member. You know, if it's a college student, you could go to the College Student Health Center and just say, I have a friend or roommate, you know, someone, I don't want to identify their name, but if they were to want to come see you, what could I tell them to expect? And do a little bit of that background legwork for someone to help the anxiety of going to see a professional kind of come down a bit for them. That would be a really nice thing to do.
Those are such great suggestions. And I think it's often a topic that a lot of people shy away from just because there's a lot of fear of the unknown and may not be quite sure about, you know, what the next steps will be. But I think early intervention is so key to getting help and to avoiding some of the really devastating consequences that come with anorexia.
I agree with that.
Yeah. So what are some of the most effective treatment methods right now for addressing anorexia?
Well, right now we don't have a lot of treatment that we could say is a cure or that will fix anorexia. What we have is the ability to help someone manage what's going on. So the number one thing is to manage any kind of, you know, life-threatening or medical complications that happen. I know that, you know, we tend to talk about anorexia in terms of someone starving, and so all the consequences of starvation are consequences of anorexia, but anorexia is not starvation. Anorexia is a mental condition where an individual isn't aware that they're starving or continues to starve even though they're aware that there are medical consequences. It's a mental condition where someone doesn't realize how sick they are. Mm-hmm. And so really that is anorexia, not the starvation. So we have to deal with the starvation itself as almost its own separate medical condition. And so that involves nutritional restoration, of course, and getting someone replenished with the nutrients that they need. If that involves bed rest or you know, minimizing physical activity in order to help someone stay well, that might be involved. And then other treatment, you know, for medical conditions might include anything that is related. So if there's bone damage, there may be treatment, you know, if someone has stress fractures or other injuries, if someone's experiencing heart damage or any kind of digestive distress, we need to symptom manage those things because sometimes they take a while to heal. So the treatment for anorexia, first and foremost, is sort of stabilization of the person's physical body. And then we have a little bit of a luxury of more time to work on the mental illness aspect. And some of the treatments for the mental aspect of anorexia are, you know, more effective than others in different people. And that's where it's really hard. It's really hard to say, here's the treatment that's best for each person. So there's often co-occurring mental illness that goes along with anorexia. So it can be a result of starvation, but it could be something that happened first. So that could be depression, it could be anxiety, it could be a traumatic life event, it could be obsessive compulsive disorder or a social phobia. And so those things need to be treated with medication and also with counseling. Some of the counseling strategies that seem to be effective for helping individuals with anorexia are cognitive behavioral therapy, dialectical behavior therapy. Sometimes ACT is used, acceptance and commitment therapy. There's also biobehavioral nutrition therapy, really any kind of therapy that helps someone with depression, anxiety, PTSD, or OCD can help someone with anorexia if they also have those symptoms. Sometimes some body image related work is helpful. Yoga has been shown to be helpful. Getting family members involved in treatment is helpful. So there's no one path. It's kind of a matter of looking at how that person got to anorexia and what the underlying other concurrent mental illnesses might be. If there's a substance abuse issue or alcoholism, obviously that needs to be addressed. So really the best treatment looks at medical complications first, stabilizing the person physically, and then the longer approach or the longer part of treatment is really that 7-year path to mental stability, mental health.
I really like how you explain that because I think there's a big misconception about treatment too, and I like how you said there's not a cure, but it doesn't mean that we can't manage the disease and make it easier for this person who might be suffering with it.
And I think that's disappointing in some ways for individuals and family members and loved ones who really want to see their family member or friend get better right away. But I think it's also a relief for the individual suffering, because they can, I'm not saying you should take recovery slow. If someone has an eating disorder, they should get treatment right away. But the idea that if they don't get better in a snap, it's not because they're not trying. It's because it's a very tough disease and it takes a long time. It takes 2 years just for your brain to get replenished from being starved. You know, it takes other parts of your body quite a long time to recover. And if someone had been in, let's say, you know, God forbid, a horrible car accident and came home after a month in the hospital with bruises and casts and stitches, it'd be easier for other people to say while they're still healing. When someone goes away to treatment for an eating disorder, or goes to the hospital for a month and comes out, it's real easy for everyone to want them to be better, because you can't necessarily see all the scars and stitches and bumps and bruises, because those are internal. It's a mental health issue, and it's also a physical health issue, but it's not necessarily visible on the outside. And so the more that we emphasize that it's a long-term course of treatment, I think the more that it frees us from judging individuals with anorexia and saying that they're just not trying to recover.
Exactly. That's such a great point. And what would you say to the person who may be struggling with anorexia and didn't have the luxury of having early intervention and treatment? I know there's a lot of people that struggle with it for years before actually getting help. And, you know, some people might actually learn to live their lives and with their disease and just manage the anorexia, but still really be suffering in so many ways.
Yeah, well, I'm glad you brought that up. You know, part of the reason that I ended up closing my practice and feeling compelled to speak out more is because I had patients who were in their 50s or 60s and had been struggling with anorexia for years. Now, of course, there are a lot of people who don't make it to 50 or 60 with anorexia, and we don't know which people will or won't. So obviously we want to help people before they get to that stage. But if someone, even if they've been struggling for a long time, there's still a quality of life issue. There may be things that you cannot undo, as far as certain kinds of heart damage or certain kinds of, you know, bone problems. But there's so much that we can help with that there's no reason to not get help just because someone's thinking, well, I've had this for so long, I'll never change, or I've had this for so long, it's not worth it. To me, there's always hope. As long as there's life, there's hope. And everyone is entitled to get help, regardless of how long they've been struggling or how short.
Sure. And I think sometimes that's a misconception too, that, you know, only like young teenage girls struggle with anorexia, when really we see it across the lifespan in every gender.
Of course, eating disorders don't discriminate, and that's really a hard concept, I think, for our society to grasp, because we really want to believe that we are immune, or, for example, you know, in my case, I have a stepdaughter, you know, to feel like, okay, well, if I could just get her through her teenage years without an eating disorder, we're safe. But what about my stepson? What about my husband? What about my mom? You know, why would we just limit our fears to everyone or to one person when we can just be afraid for everyone? But we don't like that. We don't like having a life where bad things could befall anyone at any time. So we try to think about, you know, narrowing things down and risk factors, you know, and only people over a certain age get heart attacks, and only people of a certain gender get eating disorders. It's just a way of helping ourselves feel safe and manage our anxiety. So I totally understand it. I don't judge anyone, but the truth is eating disorders affect absolutely anyone of any ethnicity, heritage, background, financial status, gender orientation, sexual orientation, gender, age, anyone, any person who eats, and maybe especially people who don't eat. But really, there's no, I mean, there's cats and dogs with anorexia. Come on, you know, it's a mental illness, and it's something that there's no reason why it can't affect anyone. And that's a scary thought, but it also helps us be open and aware, so that instead of saying, well, this person is male, so this can't be an eating disorder, and missing it for years and years, instead we can actually help people sooner by not being biased.
Exactly. And I appreciate that you're sharing those truths. It's so important for people to hear this, you know, that, and I think that helps alleviate a lot of the shame that people feel, you know, thinking like, well, I don't think I fall into the category of having anorexia. And breaking that shame, I think, helps people come forward and know that they can get treatment and help sooner.
Yeah, I think that the stigma and shame is a huge factor, and I think it's ridiculous. I I understand it, but I don't understand it. You know, I think that eating disorders are probably where alcoholism was, you know, 30 years ago, or breast cancer was 20 years ago. But now people will say, you know, yeah, I'm in AA, or people will say, yeah, I'm a breast cancer survivor, or I'm going to the 5K because I, you know, had cancer 5 years ago, or something like that. And I hope that eating disorders I believe eating disorders are moving that way. There are celebrities who will say, I had an eating disorder, you know, instead of saying they went to treatment for exhaustion, you know, you'll have someone say that they went to treatment for an eating disorder. And I think that helps decrease the stigma more and more. It's unfortunate that we feel embarrassed. And that's really, if I live long enough to see a time when no one is embarrassed to get help for their eating issues, I will die happy.
Oh, I agree with you. Well, just kind of in closing, what encouragement might you offer to someone today who is really struggling with anorexia, and whether they understand that they have that disease or not? What encouragement might you offer to that person?
Well, I think the hardest thing is recognizing honestly that you have a disease, because the society says you're making bad choices, and your eating disorder tells you that it's not as bad as you think. There's people who are much worse off. I mean, of course, you know, it's tempting to think for any of us, you know, well, my problem is either way bigger or way smaller than it really is. And, you know, depending on your anxiety level, you might go one way or the other with that. The problem with anorexia is that part of the disease is that it makes you think it's not that bad. And so if you're experiencing symptoms of, let's say, getting dizzy when you stand up, if you're isolating and not wanting to do things that you used to do, if you feel like you have to hide your size, your body, you know, from other people, whether you feel like it's big or small, to me, the issue is not what name you give your eating disorder. It's that you get help and you get an outside person's perspective. And if the first person you talk to doesn't seem to get it, then go to a second person, go to a third person. Never give up, because there are a lot of people who don't know. There are a lot of people, unfortunately, who even say that they're eating disorder experts that aren't. And so it's really important that you value yourself. And if you know that something is wrong, that you keep after it. But it's really hard. And so if it's too hard to actually go to a professional, then talk to someone you trust, whether it's a minister or a rabbi or an imam, whether it's a friend or family member, someone that can help you get help. That's the key. And even if you're not sure, even if you think you're not worth it, I'm here to tell you, you are worth it. If you're alive right now, then there's value in you. And so don't let the voice in your head that says you're not worth it or no one will believe in you, just don't believe it until you find someone who does.
Sure. Thank you so much for sharing that, Jessica. That's an important message, and I know that countless people needed to hear that. So we appreciate you sharing that encouragement.
Well, I know there were times I needed to hear it, that's for sure.
Yeah, and I think so many people who work in this field understand that and know that a person's life is invaluable. You know, no matter what you've been through, you deserve recovery.
Absolutely. And if anyone wants to talk with someone specifically, you know, at Remuda, there's, you know, you can go to remudaranch.com. You can call the 1-800 number, and there'll be someone who can kind of talk you through it. And if you called, I guarantee you, if you told someone what was going on and they said, you know, they asked you more questions about it, I guarantee you that they're not going to invalidate what you're saying and say, why did you make this phone call? There's nothing wrong with you. That's just not how it works. They really want to help. And also, if you, let's say, thought you might be able to reach out to a dietitian or nutritionist to talk with someone, because sometimes talking about your eating is maybe the easiest thing versus what's going on inside your head. There's a organization for eating disorder dietitians called IFED, and the website is ifedd.com, and you can search for a dietitian in your area and know that whoever you reach out to from IFED is someone who will understand.
Absolutely. Thank you for sharing that. And if anyone wants to find out more information about yourself, is there a place that we can go?
Sure. My own website is called understandingnutrition.com, and I also have a website that's about me, which is jessicasetnick.com. So yes, you're welcome to visit either of those or get in touch with me at info@understandingnutrition.com, and I'd be happy to try to help in any way that I can.
Great. Thank you so much, Jessica. And that concludes our time today, but we just so appreciate you being here and taking the time to share your expertise with us. So thank you.
Bye.
Thanks, everyone. And for our viewers, feel free to check out eatingdisorderhope.com for any resources that you might need. In addition, we have information about our upcoming Google Hangouts and Twitter chats that we would love you to participate in. So thank you for your time again, Jessica, and we look forward to seeing everyone soon. Take care.